Hey, what's up guys? I'm Dr. Corey here at Coastal Chiropractic in Port Charlotte. Today I want to talk about two conditions that are not only often misdiagnosed by patients, but a lot of times misdiagnosed by doctors as well. And the two conditions I'm talking about are hip pain, actual femoral acetabular joint, and lower back pain or pelvic pain. Okay, you can kind of group those two together. I want to talk about the symptoms you're going to get with each one of these, and I want to talk about where you should go when these things happen, okay, or give you a better idea of where you should go when these things happen. So the first thing I want to talk about is the actual hip joint, okay? So the femoral acetabular joint is a big pain generator for a lot of people, but typically when you get pain that's stemming from the hip, okay, you're going to get it in the groin. Okay, a lot of times people get pain on the outside of their hip or around the backside, and they think their hip is going bad or it's degenerative, and a lot of times it actually has nothing to do with the hip whatsoever. It has to do with the lower back or the pelvis, okay? Now, and what I mean by the groin pain is you're going to get pain right in here, typically. If you're having hip pain, you're going to get it here, not always out here where people think they're going to get it. That's more on the greater trochanter or the bursa of that hip, which is out here, which you can get bursitis of your hip, and actually your hip joint is going to be just fine. So rule of thumb, if you're getting groin pain, typically you're going to be dealing with something with more of the femoral acetabular joint or more of the hip, okay? If it's from the outside of that hip back, typically it's going to be something that's more pelvic or lower back related. Now, not always. You can obviously have lower back issues that aren't always going to be coming from the pelvis or lower back, and you can have groin pain that's not always going to be coming from the hip. So rule of thumb, if you're concerned about whether or not your hip is bad or if it's something to deal with your lower back or pelvis, if it's in the groin, usually you're dealing something with more of that femoral acetabular joint or ball and socket. If it's in the pelvis or the lower back, typically you're dealing something more lower back or pelvis related. So if it's from here back, usually you're dealing with the pelvis or lower back. If it's in here, typically you're dealing with something more hip joint related. So hopefully this helps, guys. Again, I'm Dr. Corey here in Port Charlotte. We're here to help you guys out. So if you have any questions, please leave questions in the comments. Please go follow our Instagram page, Coastal Chiropractic PC, or our Facebook page, Coastal Chiropractic PC. And please go follow our YouTube page, The Spinal Destination. And again, we're here to help you guys. So if you have questions, please leave comments. Thanks, guys.